Representative Hamadeh.
Thank you, Chairman Boss, for convening this important hearing today. Now, as many are aware, Arizona is emerging as a prominent technology hub, especially as states like California implement regulations that hinder American innovation. I have an interest in biomedical innovation and its broader implications, and I appreciate the opportunity to engage in this critical discussion. Now, currently, the procurement process within the VA system places the agency at a significant disadvantage, often delaying access to the latest technological advancements by 2 years. This means that by the time the VA acquires a life-saving innovation, private hospitals across the nation have already utilized it for an extended period of time. Furthermore, by the time the VA implements technology that was initiated for purchase 2 years ago, it is often outdated. Now, in my opinion, the dedicated men and women who served our country deserve better access to cutting-edge solutions, and the medical staff at VA deserve better, more modern tools to deliver that care. Now, my first question is to you, Mr. DeLullo, and thank you for your service, and thank you for your daughter's continuing that legacy in her service as well. You must be very proud. Now, I noted in your written testimony the section regarding RATE, or the Rapid Analysis of Threat Exposure. Now, this technology piqued my interest, particularly given my role in the House Armed Services Committee and your mention of Phillips collaborating with the Department of Defense on RATE. Now, could you elaborate for my colleagues on what RATE is, how it operates, and its practical applications?
Thank you, Congressman, for the question. I'd love to talk about this because it's a force protection measure for me, and it's about friends that I have that are serving on the front lines in other places in the world that they're using this today. So RATE, Rapid Analysis of Threat Exposure, basically years ago we started with the Defense Innovation Unit. It takes commercially available devices like this ring that I have on and this watch that I have on that can record, and other devices as well. They're commercially available that you can extract about 165 biomarkers, whether it's heart rate, stress level, sleep level, oxygen level, temperature. We've been building algorithms with the DoD for years as a force protection measure to determine when an individual might have a degraded state. Where this becomes particularly applicable in over years of building thousands of servicemen and women's data, we've been able to apply algorithms that allow us to determine whether someone will come down with an infection within inside of 48 hours or outside of 48 hours from actually showing symptoms. So imagine you're on an aircraft carrier and you have an infection that you haven't shown symptoms yet for a day or two. I can actually intervene and quarantine you and keep the force safe and keep the mission going. We would love to see that kind of speed and innovation working with the VA as well, because we see applications with healthcare providers within the VA, a critical resource and a constrained staff to make sure that if they are about to contract an illness that they're not, A, passing that on potentially to another veteran that comes into a VA center, or that we see a degradation that makes them vulnerable in an ill population, that we can avoid that and keep them safe and working another day.
Very good. So that's a pilot program, you said?
So we ran a pilot. It's 11,000 participants, men and women in the armed forces that are doing this pilot, even some Navy Academy midshipmen, I believe, much to my dismay. And still, we find the algorithms are trainable and learnable to new solutions and new infections constantly as we're building this pilot.
Will it be expanded?
We are working. We would love to continue the discussions with the VA to expand this into the VHA system as well, yes.
Very good. And the privacy considerations on that is being taken into consideration as well, correct?
It is complete. It's commercially available applications, but we secure that obviously and democratize or sterilize the data. So it's really looking at human condition. It's not looking at any individual or personal applicable data, personal health information.
Very good. Now, Dr. Partha Sarathy, welcome from Arizona and my alma mater for law school. Now, how has the University of Arizona used artificial intelligence to enhance patient care?
Yeah, we've been able to embed that into the electronic medical record system. And so that, for example, for sleep apnea, we run algorithms that have been developed by researchers at MIT to be able to identify and alert the clinician, the provider, the nurse, or the nurse practitioner at the very busy clinic that their patient may, for example, have sleep apnea. So, and that way they're able to be alerted to the fact that this is essentially a disease that can be diagnosed, treated, and therefore keep patients out of the hospital and reduce the risk for heart attacks, strokes, and so on and so forth. Secondly, we are developing algorithms to help them be more adherent to the treatment. Because just because there's a medication doesn't mean they're going to, or a device therapy doesn't mean that they're going to use it. So this is meant to actually be patient-facing technology that actually gives them psychological cues and advice and tips and tricks for them to be able to use the CPAP device, for example, for sleep apnea in a more adherent fashion. So we're actually collaborating with researchers at Harvard to actually develop an algorithm for us to be able to use that to help augment the ability for people to be able to use the therapies and improve. Similarly, there's actually an FDA-approved technology using algorithms embedded in an app that is helping deliver cognitive behavioral therapy for insomnia that can actually help bend the curve on insomnia or address jet lag for active duty military, for them to be able to adjust their sleep time before they travel across time zones. So there are various technological approaches, and we are being able to embrace some of them, and some of them are in development. And one particular one that I'd mentioned earlier was this Vermona technique that has been developed at the University of Arizona with funding from the Department of Defense that is looking at virtual imagery. It's almost mimicking a video game of shoot, no shoot situations to be able to test the neuropsychological decision-making of the individual. And it's being tested in 1,000 individuals who've been at the war theater in order for us to be able to address whether a 20-minute video game can replace 4 hours of a neurocognitive battery.
Very good. My time is up. I yield back.